I'm a lecturer in the School of Fine Art and NCAD, and I work mainly in the Fine Art Print department. I've also lectured on the Studio Plus Arts and Health module, and I instigated an elective module in Arts and Health in UCD in the School of Nursing and Midwifery, and that has continued to run every year now since 2015. I'm also a practicing artist, and over the last 10 to 15 years, my practice has been firmly kind of rooted in the context of arts and health practice. So I'm just going to walk you through some of the key questions that you might have if you're thinking of doing this professional diploma. And we're recording this session, so the recording will be available afterwards on the website. So we'll make time at the end for questions. If you think of questions while I'm presenting, if you want to pop them into the chat, or just wait to ask until the presentation's over, if that's okay. Okay, so this professional diploma is delivered part-time, and I'll give you a breakdown of that afterwards. It's the first time the course has run, and we're actively recruiting right now. And it's designed to fit around your time, so it offers weekends and evening sessions. It begins on the 9th of March at 20 credits, and it is at a level 9. So the programme itself has 4 modules. They will run from March to November, and they are both in person and online. And again, I'll give you a proper breakdown as we go through it. The in-person part is on campus based in the Grace Gifford House. That's just kind of around the corner from the main NCAD campus. You would also be based, for some of it, you will be visiting IMA and also in the Creative Life MISA St. James's Hospital. So all in and around Dublin 8, all in the same area. This programme aims to lay down the foundations of arts and health practice. It will provide real-world learning with industry partners and practitioners. It will offer site visits to experience arts and health in practice with input from artists and healthcare professionals. It will provide you with an ethical and critical framework so that you can understand and develop your practice and your approaches in this space. And it will advance the practice of arts and health practice in Ireland and internationally. So who is it for? So I suppose if you ask yourself the question, are you interested in collaborative practice? Are you interested in how you might engage in health settings in your work? Are you interested in being part of an exciting space with emerging intersections and new career opportunities? We would hope that we would have a diverse group with different backgrounds, because that always allows for more discussions and interesting discussions from all perspectives. And when I say, I have here might include. So when I say artists, I don't just mean visual artists. I mean all forms of art. Arts and health practice will straddle all art forms. So theatre, dance, music, film, circus, architecture, wherever you're coming from. We're also thinking that healthcare professionals, management, scientists, education, youth workers, nurses, really anyone who has an interest in the above questions. So how will I learn? So you will learn from a combination of staff in NCAD and leading practitioners in all areas of contemporary arts and health practice. So that will be curators of the work, artists who practice in this space, organisations and healthcare professionals. You'll learn through experience and immersion with these industry partners, and also by means of practice, so practical workshops. Now, when I say practical workshops, don't, if you're not coming from necessarily an arts-based background, don't worry. No art making experience is necessary for these type of workshops. So we employ a range of teaching and learning, and we would include that through attending and participating in the programme, lectures from tutors and invited speakers, seminars, and they really are supportive and discursive forums that we present and discuss models of practice in. We will have, as I said, workshops that will be active, where there'll be collaborative learning, and you will learn as well through reacting to feedback from tutorial contact, seminars, lectures, peer dialogue, artist presentations. So we do aim to have supportive discursive forums with the aim of providing and exchanging constructive criticism for students, and students are expected to contribute to conversation and feedback for their peers as well. Who will I hear from? So I can confirm that teaching on this particular professional diploma is myself, Roisin Nevin, who is the Creative Life Coordinator in MISA St. James's Hospital, Emma Eager, who is a project coordinator of artsandhealth.ie, Mary Grehan, who's the public art curator for Children's Health Ireland, Yvonne Cullivan, who is a lecturer in NCAD, but also a programme artist for Helium based in Galway, Barbara Ann Harkin, who's an art and ageing curator of the Irish Museum of Modern Art, and John Conway, who's a visual artist who's currently in a studio in Rua Red, and his practice would also sit firmly in arts and health context. He's a socially engaged artist. So quite a good range of speakers there from all different areas. Thinking then about what modules would I take? So the professional diploma is broken down into 4 different modules. We have the creative principles, which is worth 5 credits, creative experience, which is another 5 credits, immersions, 5 credits, and the capstone, which is 5 credits. So your 20 credits are made up of these 4 modules that are broken down separately. I suppose it's worth saying at this point, after you've completed the creative principles, the first 5 credit module, if you exit at this point, you have a certificate in arts and health. So how am I assessed? So the way we assess is 80% participation, engagement in module tasks and reflective documents. 20% is the final presentation, and there's no written exams. Just now to break down the different modules for you. The Creative Principles module will be 4 Saturdays on campus, and that starts on the 9th of March. And basically what this module will do is it'll be an introduction to the fundamental principles, the working methods, the skills and theories that would underpin contemporary arts and health practice in Ireland today. It will identify what arts and health practice is and what it isn't. And, you know, the roles that the arts and health practitioner play within this. It will focus on theoretical underpinnings, contemporary issues, topics and concepts relating to arts and health practice. And hopefully that will enable an approach to creative practice in health from a theoretically informed perspective. It will engage in critical reflection on the implementation of arts and health practices and develop and evidence a clear understanding of how policy can shape this work across sectors at a national and international level. So fundamentally, the principles of arts and health practice, and that is where you can exit with a certificate. So the second module is the creative experiences, and we have split this into 2 different experiences, both on different weekends and online as well of an evening. The first experience, you may have heard of Helium Arts. So Helium is the National Children's Arts and Health organisation in Ireland. So you will learn from engagement with Helium Arts. This will be 1 Saturday in person and 2 evenings online. The evenings online for these experiences are kind of important because since the pandemic, some of these platforms have had to go online. So you will experience what that's like as well. And also, if you're thinking from a health perspective, some people can't, you know, engage in arts if they are too ill to actually go somewhere. So it's another way of connecting. You'll experience Helium's methodologies and you'll be guided by Helium artists. You'll also hopefully hear from some of the participants of Helium and what they've, you know, how they've experienced it. And then you'll be encouraged and supported to apply the experiential learning to test your direction, your thinking, in your appetite and practice in a learning environment that encourages continued creative exploration in your own practice. The second experience, which again will be a Saturday in person and 2 evenings online. So you see this experience is split into these 2 parts, which are worth 2.5 credits each. So they will happen, I think, a couple of weeks apart from each other. I think the dates are on the website. This is about arts and health and the museum. So you'll be learning from Barbara Ann Harkin, who's the art and ageing curator at IMA Ireland. You will learn from an active engagement with dementia-inclusive practices within museums and galleries, and that will focus on the ASIR methodology. So its background and the context discussing the ethos and values informing the work. You will experience this methodology within IMA's galleries with the opportunity to discuss and reflect upon this. And then you will apply this experiential learning again to test your direction, thinking, appetite, etc., and how you might, you know, how you might build on this in your own work, having this experience. The third module is the immersion module. And this is the one where it isn't on a Saturday, it's actually a midweek module. So you're immersed from a Monday to Thursday in the Creative Life Centre in Mesa St. James's Hospital. So Creative Life Mesa is one of the 4 pillars within the Mercer's Institute of Successful Ageing in St. James's Hospital, and it has been a partner with NCAD since 2017, where we have had students down in the hospital in studio spaces on a Studio Plus module. So modules were developed there with undergrad students. It is coordinated and led by Roisin Nevin, and she is the Creative Life Coordinator of MESA, the Arts and Health Manager there. And she's going to be talking about from the perspective of the acute hospital setting. Now she will also be inviting other speakers to come along that have worked in the hospital. So that'll be examples of art making and creativity across the life course and the intersection of the hospital and the community. You'll understand the impact of arts participation and environmental enhancement in the acute setting on staff as well as patients. You'll consider the role of art, the role of the artist, and the creative potential of a project designed with a healthcare practitioner, the patient and the wider hospital community in mind. You'll gain access to experts in the care of older adults, and you'll be immersed in a quality, safety and improvement, a QSID hospital, an acute hospital setting, a space that aims to provide care that's safe, effective and accessible, where patients achieve the best possible health and well-being outcomes. So, there's difficulties. It's a hard space to work in when practicing in the arts. So hopefully you'll learn a lot about how this happens and how you can be an arts and health practitioner in a hospital. And if coming from the health perspective as well, I mean, you'll be able to see what has happened in these spaces, and you may be thinking about, hopefully building on the learning and thinking about how you can use that knowledge from your perspective, how you might want to work with artists in the future. The fourth and final module is the capstone module. This is 3 Saturdays. It's in person, and it's 3 evenings online. So I think this will be in November 2024. This module will see you undertake a project that demonstrates your fundamental knowledge of the arts and health practice and theories that you've been learning about. You will develop the skills and knowledge acquired throughout the program pathway, reflecting on the ability to synthesize and communicate learning into your own art or healthcare practice. So you'll be thinking about everything you've learned and you'll be building on that from your perspective, whatever that means to you. You'll reflect upon, document and disseminate your learning in the form of a creative invitation or proposal. So you'll be making it applicable to where you're coming from. And then you'll consider the creative invitation or intervention or action or output or whatever that is relevant to your own discipline that sits within the broad and creative approaches that you've learned about in arts and health contexts. And all of this, of course, is supported individually the whole way through. On the capstone, you will hear again from the speakers that you would have met over the course of the modules. So you'll hear again from Mary Graham, the Children's Arts and Health curator in CHI. You'll hear from artists who practice in this space. You'll hear from Yvonne Cullivan, who's an NCAD lecturer who works in Helium, will be back connecting in here again. And of course, you will hear from more visiting lecturers as well. So just to recap quickly, it is part-time, begins 9th of March, actively recruiting now, 20 credits. It's the first time it's run, so it's very exciting, where, it's one of types of these courses yet. So everyone's quite, excited about it, especially those that have been working in arts and health practice. It's good to see this kind of happening. And on successful completion of the module, you will hopefully have an astute understanding of how artists and curators are working to address and create sustainable solutions within their creative practices. And the course will enable learners to incorporate their skills into creative practice and future professional roles. So very broad, depending on where you're coming from. It will also open up funding schemes to you that you might not have thought about before, through Arts Council Awards, Create Ireland, Age and Opportunity, County Councils, HSE, Creative Place. The list goes on, depending on how you want to build on what you've learned. The minimum entry requirements, like all courses, we have applicants are expected to present an approved bachelor degree at a minimum of 2.2. However, there is a recognition of prior learning, so that'll be based on your prior relevant experience. And so in that case, each applicant will be looked at on a case-by-case basis. You can see to contact NCAD at creativefutures.ie. Camille, you might want to jump in if I'm saying anything that's not right.
Correct.
Okay, good. And then applicants who have not been educated through English must show proof of achieving, I think it's IELTS 6.5.
Yeah. Just getting back to how to apply, the easiest thing is to go onto the NCAD website to Art and Health, and there's an apply tab there where you can fill in the details.
Yeah, I have a link here, the Creative Futures Academy. Yeah, so creativefuturesacademy.ie, and then there's institutions. You can go to NCAD and the professional diplomas there. I've also just heard some great news that we'll be announcing a significant fee reduction, but you'll have to wait until the 1st of March to know what that is. And the reduction will apply to everyone. So also those who've already applied and accepted offers, that fee reduction will be there for you. So that's it.